How does focused ultrasound help chronic stroke pain? Imagine a treatment that can target pain deep inside the brain without surgery or long hospital stays. Focused ultrasound is a promising technology that might do just that for people living with long-term pain after a stroke. Chronic post-stroke pain can be tough to manage, often resisting medications and affecting quality of life. Researchers are exploring how this non-invasive method can help ease that suffering. Focused ultrasound works by sending ultrasound waves into specific areas of the brain or spinal cord. These waves converge at a precise point, creating either a gentle modulation of nerve activity or, in some cases, a controlled destruction of tissue. When used at low intensities, it doesn't damage tissue but instead influences how neurons communicate. This technique is called transcranial low-intensity focused ultrasound, and it's gaining attention for its ability to change brain activity without surgery. The way it helps with pain involves targeting regions involved in processing pain signals. For example, applying focused ultrasound to the cingulum bundle or the anterior cingulate cortex can alter how pain is perceived. The ultrasound activates mechanosensitive channels in nerve cells, which can change neural signaling patterns. This can interrupt the pain pathways that are overactive after a stroke, helping to normalize activity in the brain areas responsible for pain perception. There have been promising case reports showing that patients with chronic pain after a stroke experienced significant relief after targeted ultrasound treatment. In one case, a patient received therapy aimed at the left cingulum bundle and reported a dramatic reduction in pain. Over several months, they were able to stop taking pain medications, and their pain remained controlled. Brain imaging studies confirmed that activity patterns in pain-related regions returned to more typical levels, supporting the idea that focused ultrasound can modulate neural circuits involved in pain. While most research has focused on other types of chronic neuropathic pain, these findings are encouraging for stroke survivors. In larger studies involving different chronic pain conditions, more than half of participants experienced meaningful pain reduction. Some even stopped using opioids altogether after treatment. The procedure is generally well tolerated, with only mild, temporary side effects reported and no serious adverse events. One of the biggest advantages of focused ultrasound is that it is non-invasive. No surgery or implants are needed, and the treatment can be repeated if necessary. This is especially important for stroke survivors, as it reduces risks and allows for ongoing management of pain. The quick onset of relief, sometimes within hours or days, makes it a compelling option compared to medications that may take weeks to work. It's important to remember that research is still evolving. While early results are promising, more studies are needed to understand the best ways to use focused ultrasound for stroke-related pain. If you or a loved one are considering this treatment, it's essential to consult with healthcare professionals who have experience with this technology. They can help determine if it's appropriate based on individual health and specific pain issues. In summary, focused ultrasound offers a safe, non-invasive way to potentially reduce chronic pain after a stroke by directly modulating brain activity. It could help improve quality of life and support better participation in rehabilitation efforts. As research continues, this innovative approach might become an important part of long-term stroke care, but always remember to seek personalized medical advice and stay informed through trusted health sources.